Hi, this is Dr. Chris Barnes with Tensegrity Chiropractic. I've been asked by several of you to do a video on headaches. And I see headaches all the time. The reason I haven't done a video on headaches is it's kind of hard to show a before and after a headache, besides somebody saying, my head doesn't hurt. But I had one really interesting case. So this is Jeff. I'm going to talk a little bit about Jeff's story. He has suffered from migraines from 10 to 20 a month for over 20 years. He's one of those patients who's been everywhere, he's tried everything, and still his migraines persist. So he came into my office. You could tell he didn't really know if he was in the right place, wasn't sure what I could do. During my examination, I did find some musculoskeletal issues that could very easily tie into the symptoms that he was having. The big thing was we found weakness or inhibition on bilateral sternocleidomastoid muscles, or the SCM muscles, and bilateral upper trapezius muscles, which is where a lot of people keep their stress. You don't typically find them weak in the clinic, but in his case, they were all weak. From a chiropractic standpoint, we found restrictions at the occiput, which is the skull. We also found restrictions in the upper back, and one restriction in the clavicle on the left side here. He also had some eye tracking issues that we picked up when I was doing my neurological exam. Here's where things get really interesting. What's unique about our office is, while many people say that they treat the cause of pain, in our mind there's more than one cause, and what we try to do is take it up as high as we can. There's a hierarchy to what drives pain in the body, and we try to go up as high as we can within our scope of practice to find out what's the main issue driving somebody's complaint, because there could be several. So in his case, we had muscles that were weak, joints that were restricted, and some eye patterns that were an issue. He was born by an emergency C-section. The cord was wrapped around his neck, so he was actually born into trauma. After I established that the muscles were really weak in his neck, that was my entry point. And so what we did is I used muscle response testing, which is just a way to ask the body specific questions. It's like binary, yes and no. And I can ask the patient's brain exactly what's going on in their body. With Jeff, we took it back pretty far. We started with the muscles and we asked the brain, why are the muscles weak? And that actually brought up some organ dysfunction in the kidneys. The kidneys do tend to cause problems in the upper traps, okay? We then asked the brain, well, why are the kidneys upset? And we took that up to another level, getting into the nervous system. We found some things there, and we went up another notch. And we asked the brain, now, why is the nervous system upset? Why is it causing these eye issues? So testing eventually led us to emotional being the primary issue. And as it often is, especially for 30 years, he probably has the emotional component related to having migraines. I kept doing my testing until I found the key. And that key was a false belief, an idea. And we had to use muscle testing to find the exact phrasing of the issue. And what it turned out to be was, I will never be well. And I had Jeff rate it. I had him say, I'll never be well. And I said, I want you to rate from 0 to 10, how true does that statement feel? And he said a 7. If Jeff believed at 70% that he would never be well, his subconscious would direct his steps to make sure that that became his truth. And without changing that, he had a little hope of ever being well. So then I asked his mind, his brain, why do you believe that statement? And what that did is that unpackaged several trapped emotions, things in his body that he was unable to process, deal with, and eliminate. And so I walked him through those steps using various techniques. It took us about 10 minutes. When I was done asking those questions and helping his body pass those emotions out of his body, I asked him to say it again. I said, Jeff, can you say, I'll never be well? And he goes, I'll never be well. I said, why are you laughing? He goes, because I know it's not true. Immediately, the muscles in his neck were 100% strong. The eye pattern issues that I had seen before were totally normal. He talked about how much looser he felt. And that's pretty much all we did the first day. I didn't really do any soft tissue work. I didn't really adjust him. We pretty much went to the top of the heap, which was that idea that I'll never be well. I didn't see Jeff for 2 weeks. He came back in, he goes, man, I haven't had a headache in 2 weeks. And I was like, how about that? And on the 4th visit was our last visit. 20 years of migraines, and we saw him for 4 visits. And I remember shaking his hand and saying, well, good luck to you, man. And he gave me a big hug. And he said, "You gave me my life back." Now, somebody who's dealt with migraines himself for years, to finally be rid of them was the greatest feeling in the world. Now, I could have stuck to traditional musculoskeletal therapy and he'd still be in my office. He might be doing better, but he'd still be having migraines. And honestly, that's not good enough for me. That's not good enough for our office. If there is a way to fix you, if there is a way to resolve your issues that's in our scope, we will do our best to find it. Or we'll find the person who can. Our associates came to work in this office because they share the same conviction that I do, that everybody should be able to be as healthy as possible without having to rely on doctors, chiropractors, massage therapists, just to feel normal. If you have to keep doing that, something's out of balance. And that's what tensegrity is. When we restore that balance, your body's gonna work like it's supposed to. Things become easier, things become lighter. There's nothing more rewarding than helping somebody be well. It can be a better husband, better father, better employee, better all the way around. And if you're tired of living out of balance, we have 3 wonderful doctors and a loving staff that would love nothing more than help.